Hi, my name is Isaac Bogosh, and today we're going to talk about enabling diagnostic testing in countries with limited resources. Now, people who get ill in countries with limited resources have access to very few diagnostic tests. This is a major issue for several reasons. Firstly, clinicians are limited in making an appropriate diagnosis as they can only guess what's wrong with patients based on signs and symptoms, and often patients are prescribed incorrect medications as clinicians are so limited by the lack of diagnostic tests available. Now, it's difficult to have a platform for diagnostic testing in areas with limited resources because of the limited infrastructure available. Now, we have a solution for this in that we've devised a diagnostic platform that's inexpensive, easy to use, and doesn't require electricity. We've done this by harnessing the properties of a chemical called 1-tetradecanol, which can maintain a temperature of 38 degrees Celsius for days and days. So what happens is we just take blood from a patient, put it into a regular blood culture bottle, and then place that into an insulated container, such as a regular cooler, filled with packets of this 1-tetradecanol. Now the container is going to maintain a temperature of 38 degrees Celsius for days at a time, which is a perfect environment for blood culture bottles. If there's bacteria in the blood, it's going to grow under these conditions, and an embedded CO2 sensor in the blood culture bottle will change color to indicate bacterial growth. Simple. A positive test with bacteria in it can be seen on the left, and a negative test without bacteria in it can be seen on the right. It's very easy to distinguish positive from negative tests, has very inexpensive materials, does not require electricity, and can be performed by anyone. Now, this simple test can make culture-based diagnostics available in settings where conventional microbiology labs are not available, which is basically most rural, resource-limited health institutions. We believe this can improve the diagnosis and management of widely prevalent infectious diseases and enable surveillance for drug resistance, which there's little available data for in rural settings.